Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi, everyone. Thank you so much for joining us again today. Today we have, he's no longer a guest. You should be really familiar with him now. Hiep Nguyen, our PA that's volunteering with Dr. Rutherford for the next couple of months. We're really blessed to have him. But today, Hiep, we're going to be talking about the heart, right?
Oh, yeah.
Yes.
The heart.
Very appropriate for February, which includes Valentine's Day. Lots to do with the heart. And it's also National Heart Awareness Month.
Yes.
Very appropriate. So
it is.
The heart, very complex.
It is.
Yes.
It's connected to pretty much everything.
All right,
Yeah,
let's dive in. What do you want to tell our listeners about the heart and the importance of a healthy heart, right?
Right. Absolutely. Okay. So just to upfront, with the training I have and the limited experience that I haven't quite collected quite yet, I kind of want to come in talking about the heart, which is something that I'm always fascinated about. And one of the things that actually got me into medicine is the heart. But like I mentioned, it's connected to everything, and there's so much that we can talk about the heart. But coming from a primary care training and a background and future, that's kind of the direction that I want to kind of approach.
Yes.
Is kind of like, what's kind of the basics of the heart, and what is the kind of the things that we should be aware of in terms of how to keep a healthy heart.
Okay.
And what are the risk factors that can put us in a category that might put us
at risk
and give us or make us more prone to having heart disease.
Yes.
So heart disease is actually the number one killer, regardless of man or woman. It's the number one killer. I looked up the statistics on the CDC, and they mentioned it's the top one. It's the leading cause of death, followed by cancer. And those two are kind of like not neck and neck, but they're very close together. Everything else, like unintentional injuries or respiratory Alzheimer's illnesses, those are like so much fewer as compared to it.
Okay.
So yeah, the heart plays a huge role and everything affects it. So,
okay. And
there's a lot of terminology when it comes to the heart and the different heart diseases. So when I say heart disease, what does that mean? Is it the disease of the heart itself, or is there something that's more specific?
Okay.
So for like an umbrella term, we like to focus on the word cardiovascular. That includes the heart as well as the great vessels and the arteries and veins that it's connected
go out
to.
Of it.
Exactly.
Yes, comes out of it.
Those are cardiovascular. Vascular meaning the arteries and the veins. Okay. And then when we talk more about heart disease, just focusing on the heart, we interchange with the terms coronary artery disease or coronary heart disease. And that's usually where the heart disease term kind of been used for.
Okay.
So, yeah, does that make sense?
Yes. Yes.
Yeah. So,
thank you for letting a layman person with no medical background understand that. That was great. Thank you.
Yeah, absolutely. And there's a lot of risk factors that I can list for what's causing heart attacks or coronary artery disease. And just to kind of define coronary artery disease, now I'm just kind of focusing on the heart itself, is coronary arteries are the arteries that supplies blood and oxygen to the heart itself, because the heart is a muscle. It needs nutrients to perform. So those arteries, they can get clogged. They can be obstructed in a way that prevents the appropriate nutrients like oxygen to the muscle of the heart, and eventually lead to something people call heart attacks. Myocardial infarction. Infarction just means the lack of, it's mostly tissue death due to lack of oxygen and blood supply.
Wow.
So
that really gave me a visual of tissue death. Wow. Okay.
Yeah. And being so complicated, if the tissue is not functioning properly, the electrical conduction of the heart is not going to be able to work well, and it won't tell the heart to do what it's supposed to do.
Yeah. It's like could we compare it to the engine of a car? Like if it's not having its oil change, if it's not the valves, if it's being blocked or something like that, your car dies. Your car doesn't work very appropriately. It needs to be maintained like anything else in your body.
Absolutely. It sure does. Yeah. And from that, what causes those obstructions from the heart, right? What is causing the heart tissue to die other than the lack of nutrients? Like what's preventing it from getting there? And most oftentimes, from primary care standpoint, there's three things that we want to make sure we focus on directly with the heart is hypertension, the blood pressure, right? High blood pressure can affect future heart disease. High cholesterol, definitely.
Heard about that.
Yeah. Those are actually the things that are blocking the arteries. And I can get into more about that. And the other thing is diabetes. Diabetes is one of the leading causes for heart disease. And in primary care, those are kind of the three things that we like to monitor, treat, and manage so that we can prevent future heart disease. And that's kind of where I'm trying to come from. Okay. Right? And what's interesting while I was doing some research on this heart issue is that men and women, even though are affected by heart disease and is the number one killer in both sex, from what I've learned, the risk factors are a little different in men versus women. So, like I mentioned, hypertension, high cholesterol, diabetes are the risk factors for both sides. However, I learned recently that women who had pregnancy complications or adverse events has an increase in cardiovascular disease. Also, autoimmune diseases. Increases a woman's risk. Right. Yeah. And it's kind of interesting because about 80% of people who have autoimmune disease are women. So
I didn't know it was that high.
I didn't know it was that high either until I learned that from a doctor over in the Cleveland Clinic. I was listening to her podcast and she was like, there's about 80% of people who have autoimmune diseases are women. And those kind of illnesses and conditions really elevate the risk of developing heart disease. This doctor mentioned it's about like 3 to 4 times an increase. Wow. Which is quite bizarre. And that's kind of like the additional risk factors for women. And when it comes to like diabetes and high blood pressure, for a woman with diabetes, she tends to be diagnosed with diabetes at an earlier age. So she'll probably get the risk of getting heart disease is earlier. So that's something that I've learned over this past couple of days.
That is so interesting.
Yeah.
That's so interesting.
It's interesting.
So when you learn that you have heart disease earlier, is there a treatment for heart disease? What's the solution when you are diagnosed with heart disease?
Yeah. So that's a good question. Obviously, it's like now we know there are these risks and I'm having heart disease. What do I do? There's a whole branch of cardiologists that kind of come up with all these things to first of all, diagnose it. And to treat it, there's medication that you can use to kind of slow down the development of heart disease. And there's also surgical when it comes to that point. So most oftentimes what we try to do is prevent an adverse event from happening with the heart. So in terms of treatment, I'm not quite versed in it yet, but I know there are definitely with medication and with
lifestyle change.
So that was where I was going to come in next. Aside from medications and surgery and different diagnostics that we do to monitor and treat heart disease, there's lifestyle changes too that can help with the treatment. Another doctor I remember mentioned like it's 30% medication to treat heart disease and 70% of it is lifestyle.
Wow.
So I know that we've been talking about heart diseases, how it's like the risk is great for women versus men, or you know, it's a leading cause of death. But the thing about it is that it's very preventable. There are things that we can control.
Yeah. So it's not a death sentence.
Exactly. Just because you're at risk doesn't mean that you get it. And just because you have it doesn't mean that it will be, you know, the thing that'll take you. But, you know, it's important to know that we can do a lot to help with preventing the progression of heart disease. And even though it's simple just to say lifestyle changes, it's very difficult actually for a lot of patients. So when I talk about lifestyle changes, I have a whole list here of how to make your heart healthy, right? So eating healthy is one thing.
Okay.
Being active is another. Maintaining a healthy weight.
Okay.
Those two are like the main things.
Yes.
That you hear a lot oftentimes when you see a provider. And like when I was doing my rotations and learning about hypertension, a lot of times like, hey, take this medication as well as go for brisk walks and eat healthy food.
Right?
Exactly.
Get up and move, right? Yeah.
And it's a lot easier said than done.
Absolutely.
That's the most unfortunate thing about it.
Oh my gosh.
Yeah. It's not so simple when I'm sitting in the classroom. It's like, oh, just tell your patient to go walk more or go do this.
It's a whole... You have to get that person to mentally change and accept if you don't make these changes, your risk of dying multiplies, right? Like, I mean, you don't want to scare the person.
Yeah.
But when it comes to the heart, is a very serious muscle, a very serious organ.
Yes.
Can I say organ?
Yeah.
Okay. Very serious organ to protect and maintain and keep happy.
Yeah.
Because it does so much. It does so much. So before we get into like what are some preventative ways or some reversible ways of heart disease that we can try to convince or motivate a patient to change, what are some ways that you know your heart isn't in a good shape?
Yeah.
Like what are some
symptoms?
Warning signs? Symptoms. Thank you.
Yeah.
Warning signs.
Thanks for bringing me back to that.
Yeah.
I forgot to talk about it.
Yeah.
So a lot of times when we're talking about the heart not getting enough oxygen, not getting enough nutrients, what I found really interesting is that when something, like especially the heart, lacks oxygen, it dies, and that's how we feel pain. So most oftentimes, chest pain is a common symptom. You can get what they call shortness of breath, especially during exercise. So for example, if like I can walk to a mailbox, like maybe out in front of my house, one year, and then the next year it's becoming really difficult for me because I'm taking a lot of stops to breathe, just going out to my mailbox.
So doing just normal tasks is increasingly difficult.
Right. Like if you have like a 2-story house, walking upstairs one year might be easy, and then the next year might be a little harder.
Yeah.
That's kind of concerning because your heart is working a lot more now to use that same amount of energy to get you upstairs. So that's kind of the things that most patients will kind of notice. Is like, hey, I'm starting to get really tired going upstairs or going this amount of miles or walking. So chest pain, and it's not necessarily chest pain for a lot of patients. It's more like chest discomfort.
Yeah.
It's like a pressure
tense.
feeling. Yeah.
Yeah.
Intense, like an elephant sitting on your chest.
Yeah.
It's a description I hear often.
A lot. Yeah, I've heard that as well. Yeah.
Yeah. And when patients have, let's go to the extreme, and they have a heart attack, chest pain, they can get shortness of breath. They can have like that pain kind of travel along their left arm.
Okay.
And sometimes, mostly male patients, they can feel a tightness in their jaw, pain in their neck. And then that's kind of like a sign that, well, like maybe this is a precursor to a heart attack. Most of the developing symptoms that we kind of suspect when it comes to coronary artery disease is, you're having a harder time doing your normal activity.
Okay.
You're having some chest pressure.
Those are some warning signs.
Yeah, that's where I really want to kind of go see my doctor about. But kind of going back to the symptoms, the variance between men and women and what they experience, women experience heart attacks a little different than men. It's more subtle. So
great.
which is really, really interesting for when I was learning about it.
Yeah.
And like, for example, both men and women will experience nausea and vomiting, some jaw, neck, and back pain when they are experiencing a heart attack. Sometimes women won't feel chest pain at all. And both men and women can have shortness of breath.
Okay.
But women can feel more faint. She might have some symptoms of indigestion, and extreme fatigue was one of it as well. And I was like, interesting.
Yeah.
So those are all the symptoms that I would kind of expect to keep in my head when a patient comes to me and talking about those kind of concerns. And I will be putting, heart issues as a differential just to make sure that it's something I don't miss.
Yes.
Because it can be very deadly.
Yeah.
Yeah, absolutely. So.
Wow. Okay. Yeah. Wow. This really makes you think, how is my lifestyle contributing to my heart health? Yes,
absolutely.
Yeah.
And the biggest challenge in that is that it's not just one day. It's throughout your entire life that you have to do this. And that's where the challenge really comes from.
Yeah.
So.
Yeah. Putting into practice every day, doing a little bit for it.
Right.
To make sure that it's maintained, at least.
Yeah, absolutely.
Yeah.
And there's many ways that we can do that, maintaining our heart health. Kind of going back to the three things I mentioned earlier, which plays a part in the heart disease, is hypertension, which is high blood pressure, diabetes, and high cholesterol. So all those three can be modified. Yes, medication, but there's ways that patients can actually cooperate with the medication by their lifestyles. And that's kind of where the challenge mostly is for them. Okay. Well, it can be a challenge for their primary care provider too, but that's kind of where patients and provider kind of work together to make sure that there's the best plan for the patient. But diving into like the lifestyles, eating healthy.
Yes.
That is the number one thing about heart health, is making sure that the contents you put in your body is good for your body, especially your heart.
Balanced.
Yeah. Specifically with high blood pressure, there is this diet called the DASH diet. It stands for Dietary Approaches to Stop Hypertension.
Wow.
Yeah. It's pretty much just a way for patients to know that, we need to put more color in our meals.
Yeah.
More fruits, more vegetables.
Yeah.
Lean meat and fish those are the ones that we try to have patients kind of focus more on. And just decreasing the amount of salt that patient intake. And that's what they call sodium on the nutritional facts in the back.
Yes.
The sodium.
Yeah.
Yeah. Because sodium kind of plays a role in the volume of the cardiovascular volume. With more salt kind of retains water. So when there's more water in the pipes, there's more pressure because of that.
Wow. Okay.
Yeah. And again, that's really difficult for a lot of patients. So there's a whole department like nutritionists.
Yes.
And those people I would definitely rely on because they know so much more than I do. And the nutrition is very important, and they are definitely part of the team, the healthcare team that can help patients not only with hypertension, but with diabetes as well.
Okay.
Yeah. And one of the things that irks me a little bit sometimes when I was learning about hypertension and ways to prevent high blood pressure and heart disease is telling patients to be active. It irks me because it's not as easy.
No, it's
because
not.
I can't even get myself up in the morning to go running. So it's really hard just to like kind of result to that. That's why medicine's kind of an art, and just working with patients to see like, hey, how can we get you out of the couch or off your bed once in a while?
Yeah.
Just to do that. And
and I guess like what, for me psychologically, when a medical provider says that, okay, you got to get up, you got to move, you got to work out, it all seems really overwhelming, but you're not telling them go out and run a 10K marathon, right?
Exactly.
That's not what you're trying to tell them. That's a lot. And you have to train for that kind of stuff. But simply getting up, going for a walk around your neighborhood, maybe a block, you start off with a block.
Yeah.
And then you add on another block the next day, or even in a few days,
Exactly.
But it helps you just get out of that mentality that you can't do something, and that ties so perfectly into one of our earlier podcasts with Christy Emmons, where she is just encouraging people, especially during COVID right now, when the world looks gloomy, when there's a pandemic going on, you can't go outside, you can go outside. You can get some fresh air.
Absolutely.
But, getting over that hump of like, this isn't going to help. It does help, right?
Absolutely. It does help.
Yeah.
It's healthy for your physical aspect as well as your mental aspect too. And thank you for clarifying. Yeah, I don't mean go out there, run 2 miles. Do it. You can do it. Just be like Rocky Balboa. But yeah, like what most organization heart associations kind of recommend when they say get active or be physical is like a brisk walk for like 30 minutes or so, or like a slow jog. It's that preparation to do that is the hump that we have to really get over. But what I've been doing actually with my nephews and niece and my mom, I'm trying to get my mom to do it more too, is just go outside and walk around the neighborhood.
Yeah.
I know like in some areas it's difficult to do that because of rain, especially here in Seattle.
Sure.
Right.
Get some cute rain boots. Go outside. Like
it's just rain.
Exactly. It's just water. Get a cute like raincoat, something that can motivate you to get out there.
Absolutely. And what I have done that I found really helpful in terms of getting myself out is to do it at the same time every day. I do it after lunch. So it's a
routine.
Yeah. So it's a routine. It becomes a habit.
Yes.
And I learned that after you do something as like regularly for 3 weeks, it becomes a habit. So it's really important.
Yes.
Just to keep going, especially on those hard days. And what I do when it's raining outside sometimes and my nephews and nieces are too lazy to go outside, we just walk up and down the stairs.
Wow. That's great.
Yeah. And the greatest thing about that is when you do exercise and physical activity, it's always nicer to do it with someone else. That's why I bring the kids with me.
Yeah.
So that was fun.
Or if you're by yourself, put on a nice audiobook.
Yeah.
We all need to be reading more anyways. A nice podcast. There's so many good podcasts out there, including 3W's podcast that you can listen to.
Yeah, absolutely.
So you don't, it doesn't feel like you're in it alone.
Absolutely.
You can be productive in so many ways while still being active. And actually that distraction has been really helpful for me, who hates to exercise. I'm the first to admit it. And sometimes when I'm watching something like a YouTube video while I'm exercising, it makes time goes by so much faster.
Yes, absolutely.
Yeah.
Those are the two kind of the big things, hard things, simple but hard things to do. The other thing actually that I want to talk about too is smoking. If you know someone who smoke and having heart problems, number one thing we tell patients to do is quit smoking.
Yeah.
Again, hard.
Yes.
And I totally hear smokers sometimes when they say it's hard. It's like, absolutely, I'm not blaming you for doing it. But smoking definitely affects the heart in many ways.
Yes.
It affects the lungs, obviously, which is right there next to the heart. So quitting smoking can definitely extend your life in many different ways other than how your heart is.
Yes.
So yeah, number one, eat healthy. Number two, get active, brisk walk or a light jog. Something I forgot to mention is, if you can't go outside, get some weights. Some resistance training can really help with that too.
So it's all about getting that heart
pumping. Yeah.
Sweaty, active. One of the things that I noticed during COVID is that it's been really, really difficult to get weights on Amazon delivered to you because everybody's suddenly working out at home because you can't go to the gym,
Same thing with treadmills.
Yeah.
Actually, which is good. Good.
Great. Everybody should buy one. But when Christy and I were talking about being active, there's this YouTube fitness person that I follow, and she's like, hey, do you like wine? Do you have some wine bottles? Go grab a wine bottle and start using it as your weight. Grab something. Your chair, move up and down, get up and down your chair. I mean, there's so many creative ways now that you can work out at home safely, responsibly, and just using the things around you.
Absolutely.
But the whole point of that, the whole goal is to get you up and active.
Yes.
Up and moving.
Yes. And it's an interesting segue. When you mentioned wine, is alcohol consumption actually can affect the heart. I don't know the specifics into that, but the recommendations these days are for men, no more than 2 drinks per day, per week.
Okay.
And for women is no more than 1. So that's another way to kind of help with a healthy heart. Not saying, don't ever drink. Sometimes we need a little bit of libation to help through the day, but not excessively is kind of the idea here.
Right. One of the things that we always say in these podcasts, specifically when we're giving more medical education, more information, is the word we like to use is moderation. Yeah. Everything in moderation.
Even moderation.
Yes. And ladies, your 1 cup that Hiep is talking about is not a giant bowl. That does not count as 1 cup.
Yes.
Because there's a lot of really fun wine glasses out there that we know it's more than 1 cup.
Yeah.
It's more than 1 glass.
in my training, we were always told, when you ask patients if they drink alcohol and how much, and say 1 glass, it's like, you want to specify how big that glass is.
If it's making you go, is this the right size? It's probably not the right size. Go pick something smaller. Everything in moderation, everything with balance, and looking at the whole picture, not just
absolutely
one thing good or bad. So
yeah.
Anything else you want to tell us about the heart, Hiep?
Yeah, another thing that we can do actually is something that I really advocate for is mental and behavioral health. And this is where how it's difficult to go for a walk every day, how to prepare meals every day. Your mental health and all of that is so crucial to what you do. And it affects how stressed you get. It affects how much sleep you get. So all of that kind of falls under the mental category for me personally.
Yeah.
And that's why I want to make sure I get to learn about the patient, their lives before I understand their, I kind of do it simultaneously with the physical health, but also taking into consideration mental health too. A lot of primary care practices nowadays are incorporating mental health into their practice, which is awesome. And that's really something I'm advocating for, because how to get a patient to eat well or to be active is to make sure that they themselves are mentally well. And they're well supported.
Yes.
Absolutely.
Yeah. Well, from what I know from the nurses that I've interacted with, mental health, spiritual health, physical health, all those are the pillars of health that,
Yes.
And we're so proud and lucky to be able to provide that 1 hour unrushed care to our patients so that we can capture these factors that plays into the healthcare that we can provide for you. We really try to take a step back and look at our patients from a holistic standpoint and say, okay, how are all of these pieces, how are all of these layers contributing to why you're here today?
Absolutely.
And that's something that's really, really important to us. I know that's very important to our providers. In fact, it's one of the things that attract our providers to want to be here is because they feel like they can really give good care, high standards of care to their patients. So,
yeah, absolutely. Yeah. And if you're ever concerned about your health or your heart, I recommend go see your doctor.
Yes.
Or your PA.
Yes. Come into 3W and talk to HIP about your heart. And would you like to more, if you want to learn more about it, it's a free visit. Yeah. No, nothing to lose, more education to gain. So you can always do that with us. Please book an appointment. Please give us a call. Come in and talk to HIP more about this. Come in and share your experience about how you had heart disease and now you don't. I mean, that's great. Let us celebrate with you. And with that, just anything else you want to educate us with today, HIP?
We're not in this alone.
Yes.
So, being there for one another and supporting, whatever goals you have.
Yeah.
We're always here to help, especially for me on the medical provider standpoint.
Yeah.
So,
yeah. Well, thank you. Well, that was very educational for me, and it shows your heart that you want everybody's heart to be well and to be healthy. And so thank you, listeners, for tuning in. Thank you for giving us a chance to, again, dialogue with you a little bit more about this very important topic. You're important to us. You're part of our community, and we want you to be well. We want you to be healthy and happy. So again, give us a call if you have any questions. Come in and talk to HIP, and thank you for tuning in. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.